Our guest this morning, Dr. Linda Niessen, our good friend, the Dean of KCU College of Dental Medicine. We're talking about the impact of diabetes. Lots of people have diabetes, and it can have an impact on your oral health, Dr. Niessen.
You're absolutely right, Tiffany. People don't realize, diabetes is a serious chronic disease that can affect all systems. You have diabetic eye problems, heart problems, kidney problems. You can also have diabetic teeth problems.
What are some of the things that people should be aware of?
People with diabetes are much more likely to get periodontal or gum disease.
Okay.
So for you, if you have diabetes, it's even more important to go to the dentist on a regular basis.
You're looking at some of them on your screen now as you talk us through them, Dr. Niessen.
The other issue is thrush, which is a fungal infection. It's a fungus infection that, the fungus is always in our mouth. Healthy people don't get it. And when you see it, as a dentist, it says to us, this is a person that has some sort of systemic condition. And people who, before they're diagnosed with diabetes, may come down with a thrush infection, which is often the dentist's first indication that something else may be wrong. Healthy people don't get thrush.
Right.
So when we see it, we know to say to people, oh, you might want to check.
What can people do if they are having some of these issues, and how can they be controlled?
Probably the most important issue is you need to see the dentist regularly, and you may see your hygienist to get your teeth cleaned, and the dentist and hygienist may say, gee, every 6 months isn't enough for you. Your diabetes really requires you to be seen maybe every 3 months instead.
Just to keep an eye on things.
Just to keep an eye on things and
or
to
if
control
they're having things that are going wrong.
Right, that's exactly right. They may be more likely to have an abscess. So you want to make sure that you're seen regularly. You also want to tell your dentist what medicines you're taking. When you go to that initial exam, sometimes bring all of the medicines you're taking so that the dentist knows what your various conditions are and the medicines that you take for. Because many medicines have side effects that cause side effects in the mouth, most commonly a dry mouth.
So, so all of those things, and your dentist, like you were saying, can help you with some of those things so that you're not dealing with it as much, because that can be really annoying.
Well, you have to keep in mind, diabetes is a wound healing disease. People with diabetes don't heal well. So it's really important to talk to your physician and your dentist to make sure you have good care to keep your body healthy. And prevention is always the best. If you have diabetes, try to manage your blood sugar. I know that's so hard.
Yes.
It's so hard. And don't smoke. Smoking only makes diabetes worse.
You guys are plugging right along. We were talking a little bit in the commercial break. Second class is coming in soon.
Yes.
Such exciting times.
Our class of 2027, who started last August, are now D2s. They're in their second year.
Yes, that's fabulous.
And they're going to be in the clinic starting to do exams and cleanings and preventive services. So,
as a reminder for our viewers who are watching, they can come make appointments at the clinic, right?
Yes. You can come in right now. The faculty are seeing patients with urgent care needs, with toothaches and urgent problems. We take insurance. We also have a fund for uncompensated care if people don't have the money to pay for dental care. So we welcome anyone to come.
Fantastic. Okay. Well, Dr. Niessen, thank you so much for being here. We so appreciate it. It's always great to see you.
Thanks. My pleasure.
Appreciate it.